Hi guys, welcome to Fast Coder 21 Medical Coding YouTube channel. The purpose of this channel is to help the people and also share knowledge and gain knowledge. If you are already subscribed to our channel, help your friends to subscribe. Otherwise, if you are visiting for the first time, then click on subscribe button to receive future updates. Next, who can visit our channel is freshers, experienced coders, aspirants of CPS, CPC, and CCS certifications, and anyone who are trying to enter into the medical coding field, and also anyone interested in learning medical coding. So, if you have any other topics or concerns, please mention in the comment section, guys. Please click on like button to encourage us so that we can make more sessions which are useful for everyone. Please watch until the end to gain in-depth knowledge about ICD-10 CPT, HeekPix coding systems, as these Q&A sessions are very useful in live coding, medical coding interviews, CPC and CCS certification process. Guys, one thing we would like to clear you is this channel is for only helping the people. So for example, if you go to any interview, you need to familiar with your code books like ICD-10 CPT, HeekPix. We need to give first priority to our books. So today we are going to learn anesthesia question and answers part 1. Question. Tell me about yourself. Answer. Tell the interviewer about your past, present and future ambition. What would you like to become in the future and how do you want to go up? Don't be nervous here. Just keep calm and keep go. Second question. What is anesthesia? Here if you divide this word anesthesia, An means no. Aesthesia means sensation. Here, what is anesthesia means? It will remove the sensation. So, answer anesthesia is defined as the loss of sensation with or without consciousness, generally induced by the administration of particular drugs. So, based on the procedure, anesthesiologist will administer the drugs. Question. How many types of anesthesia do we have? Answer. We have topical anesthesia, local anesthesia, regional anesthesia and general anesthesia. Anyway, don't worry. Going forward, we are going to learn the meaning of all these terms. Question. What is topical anesthesia? Answer. Topical anesthesia refers to the application of a drug to the skin to reduce or prevent sensation in a specific area temporarily. Like in topical anesthesia, they will apply ointment like creams to numb the area. So, what is local anesthesia? Local anesthesia refers to the injection of a drug to prevent sensation in a specific portion of the body, includes local infiltration anesthesia, digital blocks, and pudendal blocks. All these comes under local anesthesia. So, it is related to specific area of the body. Next question. What is digital block anesthesia? Answer. The digital nerve block is a procedure in which an anesthetic solution is injected into the base of a finger or toe to provide regional anesthesia. See, digital means already here it is mentioned as digit, so which is digital block anesthesia. Question. What is pudendal block? Answer. A pudendal nerve block is historically a common regional anesthesia technique to provide perineal anesthesia during obstetric procedures, including vaginal birth during the second stage of labor, vaginal repairs, and anorectal surgeries such as hemorrhoidectomies. So, usually we are using this anesthesia in obstetric cases. Question. Can you tell me one local anesthetic name? So, answer. Lidocaine is one of the frequently used anesthetics in the surgery. So why means whenever you see lidocaine, we need to remember that this is one type of anesthesia used by the anesthesiologist. Question. Can you report topical or local anesthesia with any surgical procedure? Answer. No, we can't report both as these are included in surgical procedure. So defaultly in surgery, these two anesthesia types are included. So we no need to code these two types of anesthesias. Question: what is regional anesthesia? Answer: regional anesthesia prevents a section of the body from transmitting pain and includes epidural, caudal, spinal, axillary, stellate ganglion blocks, regional blocks, and brachial anesthesia. Next question: what type of anesthesia you can use for large area of the body? Answer: we will use general anesthesia for large body area. Question: what are peripheral nerve blocks? Answer: peripheral nerve blocks, which are typically used for procedure performed on the extremities, like arms, legs, or on the groin or on the face. Mostly they will use on the extremities. Next question: when do you use epidural or spinal anesthesia? Answer: epidural and spinal anesthesia, which employs an anesthetic injected into the spinal cord, most often to numb the lower abdomen, pelvic area, or the lower extremities. So name here epidural indicates it is related to spine, and spinal anesthesia is also related to spinal region of the body. So here, so to numb the lower abdomen, pelvic area or the lower extremities, physician will use epidural or spinal anesthesia. Next question: how do you define general anesthesia? Answer: general anesthesia means the administration of a drug in order to induce a loss of consciousness in the patient who is unable to be aroused even by painful stimulation. So, general anesthesia is full unconscious. So, patient can't feel any pain also using general anesthesia. Patient is fully unconscious. Next question: what is the other name for general anesthesia? Answer: another name for general anesthesia is surgical anesthesia. Next question: what are the routes of administration of general anesthesia? Answer: general anesthesia is given to the patient by inhalation, intravenous injection, or on rare occasions intramuscular injections. Sometimes in operative reports we used to see like LMA, laryngeal mask airway. This is the inhalation process. Usually they will use intravenous injections also, or sometimes based on the procedure and patient condition they will use intramuscular injections too. Next question: can you tell me one example for general anesthetic drug? Answer: propofol. Question: what is moderate conscious sedation? Answer: with conscious sedation, the physician gives the patient medication to reduce anxiety and stress. So, using this moderate sedation, physician tries to reduce the anxiety and stress of the patient who are going to undergo the surgical procedure. Where do you find conscious sedation codes in your CPT book? Answer: in medicine section we can find conscious sedation codes. Next question: how do you code if the physician performing the procedure also administers the conscious sedation? Answer: we need to code from the 99151 to 99153 range of CPT codes. Next question: what is meant by monitor anesthesia care? Answer: if an anesthesiologist administers the moderate sedation, this is known as moderate monitor anesthesia care, which is reported from the anesthesia section of CPT codes. Next, most important question: when does the anesthesia time starts and ends? Answer: the anesthesia clock starts when the physician administers the sedative and stops when the patient is discharged and the physician is no longer required to supervise the patient. Next question: what is total time? Total time is calculated only for the minutes of the physician continuously spends face to face with the patient. So here our keyword is face to face. If the physician is face to face with the patient only, we can code total anesthesia time. What are the steps involved in anesthesia coding? Answer: first step, we need to check physician who performed the procedure, like anesthesiologist or procedure performing physician. Next, second step, need to identify anatomic site of the patient. So we need to know where we are going to do the procedure as well as the anesthesia. Next, third step, need to check procedure performed. So we need to analyze which procedure we are going to perform. Fourth step, need to check anesthesia section in the index per site. Fifth step, need to see in the CPT book. Sixth step, need to read the description properly to identify the proper code. So if you remember these 6 steps, it is very easy to code anesthesia coding. What is 47 modifier? Sometimes when the same physician who performs the procedure also administers regional or general anesthesia, at that time we need to use 57 modifier anesthesia by surgeon to the appropriate procedure code. So if the physician performing the procedure administers general or regional anesthesia, we need to add 47 modifier to the appropriate procedure code. What is ASA? Answer: the American Society of Anesthesiologists. Next question: what is P1 modifier? Answer: P1 modifier means a normal healthy patient. Next question: if the patient has controlled type 1 diabetes, which modifier you can use? Answer: I can use P2 modifier, a patient with mild systemic disease. When do you use P6 modifier? Answer: a declared brain dead patient whose organs are being removed for donor purposes. How do you code anesthesia for separate or multiple procedures? When multiple procedures are performed during the same operative session, but the anesthesia is continuous, the anesthesia should be coded for the most complicated procedure only. So we need to use anesthesia for more complicated procedure. Who is an anesthesiologist? Answer: anesthesiologist is a physician specializing in the administration of anesthesia. Next question: what are the services included in anesthesia code package? Answer: usual preoperative visits, anesthesia care during the procedure, administration of fluids, monitoring services like ECG, BP check, postoperative visits. What are qualifying circumstances? Answer: qualifying circumstances causes anesthetic process more complicated. Next question: what is the code 99116? Answer: anesthesia complicated by total body hypothermia. Next question: anesthesia complicated by emergency conditions, which modifier you can use? We can use 99140. Next question: what is QA modifier? Answer: the QA modifier would be used to indicate that an anesthesiologist was available and oversaw the administration of anesthesia services provided by someone else, such as CRNA. CRNA means Certified Resident Nurse Assistant. Next question: what is RVG? Answer: numeric value assigned to a procedure in relation to other procedure in terms of work and cost. What is PACU? Post Anesthesia Care Unit. Next question: what are the documents needed to code anesthesia coding? To code anesthesia, we need pre-anesthesia record completed by the anesthesia provider, anesthesia report completed by the anesthesia provider, post anesthesia record completed by the anesthesia provider and post anesthesia care unit team. Next one, surgeon's operative report. And next, based on the client specifics, we need to use few more documents. Next question: bronchoscopy and laryngoscopy are included in the anesthesia. Yes. So here these two procedures are included in the anesthesia administration process. So we no need to code separately. Next question: what is PCA? PCA means patient controlled analgesia, which allows self-administration of intravenous drugs through an infusion device, which is controlled by patient himself or herself. Guys, these anesthesia topics are very useful for the live coding people and experienced coders, freshers, and CPC and CCS exams procedures also. So now we have completed part 1. So we are going to publish part 2 very soon. Thanks for watching our channel. Remember to subscribe and encourage us. Please keep comments in the comment section and also encourage your friends to subscribe to our channel to get more interesting topics. Happy coding, guys!